5 minutes. That could be enough time for consciousness to vanish, brain cells to swell, and some of the most sensitive neurons to begin dying. But here is the surprise. The damage does not wait quietly until minute 5. It starts as a chain reaction almost immediately. First, let's make the scenario precise. This is not you holding your breath. During a breath hold, your heart still moves oxygen stored in your lungs and blood. In our scenario, sudden cardiac arrest stops useful blood flow to the brain completely. In real life, you never watch a timer. You call emergency services, start CPR, and get an AED. Why does the brain fail so quickly? It is only a small part of your body, but it is constantly spending energy. Neurons use that energy to pump charged particles across their membranes. Those tiny electrical differences let you see, think, speak, and move. No circulation means no fresh oxygen, no glucose, and no reliable way to keep those pumps running. At second 0, the last useful pressure wave passes through the brain's arteries. Oxygen has not magically disappeared yet. A small amount remains in the blood and tissue. But the delivery truck has stopped. The brain is now spending its final local reserve with nothing arriving behind it. Within roughly 20 seconds of complete cerebral circulation stopping, that reserve can be exhausted and consciousness can disappear. The character's vision closes in. Posture fails. They collapse because the networks coordinating awareness and muscle control can no longer stay organized. This is not sleep. It is a system-wide energy failure. Now enter the first minute. Neurons begin running short of ATP, the molecule that powers their microscopic pumps. Sodium starts moving into cells. Water follows it. The cells begin to swell. Meanwhile, potassium leaks out, and the clean electrical signals that once carried thoughts dissolve into noise. Here is where the problem accelerates. Struggling neurons release glutamate, a normal chemical messenger used in the wrong amount. It opens more channels. Calcium rushes inside. Enzymes switch on and begin damaging proteins, membranes, and DNA. Doctors call this excitotoxicity. Think of it as the brain's communication system becoming an amplifier for its own emergency. By minute 2, you would not be experiencing a clear countdown. You would almost certainly be unconscious in this complete no-flow scenario. Inside the skull, however, the emergency keeps spreading. Blood vessels are empty of useful circulation. Carbon dioxide and acids accumulate. Cell membranes lose control, and microscopic swelling starts changing the tissue around them. Not every brain region is equally vulnerable. The hippocampus, which helps form new memories, is especially sensitive. So are parts of the cerebral cortex, the basal ganglia, the thalamus, and the cerebellum. That means a survivor may wake with problems involving memory, movement, coordination, attention, or awareness, even when the heart itself is beating again. At minute 3, the injury is still not uniform. Some cells are struggling, but potentially recoverable. Others are crossing chemical thresholds that make recovery harder. Temperature matters. So does age, health, the cause of the arrest, and whether even a little blood flow remains. This is why medicine cannot place one identical stopwatch inside every person's brain. Minute 4 is the dangerous border people often summarize too neatly. You may have heard, brain damage starts after 4 minutes. The safer version is this. With complete oxygen loss, the risk of irreversible injury rises rapidly around this period. Some cells fail sooner. Others last longer. There is no single frame where the entire brain changes from alive to dead. Then comes minute 5. Medical references warn that some brain cells can begin dying in less than 5 minutes after their oxygen supply disappears. Energy production collapses. Ion pumps fail. Swelling, calcium overload, and destructive chemical reactions are now well underway. 5 minutes is not automatic brain death, but it is a severe emergency with a much worse neurological risk. Now, imagine circulation suddenly returns. Problem solved? Not completely. Fresh blood brings the oxygen the brain desperately needs, but reperfusion can also produce reactive molecules and inflammation. Damaged blood vessels may leak. The brain can swell. Seizures or poor blood flow regulation may create a second wave of injury over the following hours and days. That is why hospitals do more than restart the heart. Teams manage oxygen carefully, control carbon dioxide, support blood pressure, monitor temperature, treat seizures, and use scans and electrical tests. They also avoid predicting the final outcome from one early sign. Recovery is assessed over time, using several kinds of evidence together. So can someone recover after 5 minutes? Yes, it is possible, but no honest narrator can promise the outcome. A person with partial flow, rapid, high-quality CPR, a reversible rhythm, and excellent post-arrest care is not the same as someone with 5 full minutes of zero circulation. Even temperature can change how quickly cells spend energy. The exact story belongs to the conditions, not just the clock. Here is the part that matters outside the animation. If an adult collapses, is unresponsive, and is not breathing normally, or is only gasping, call your local emergency number. Begin chest compressions in the center of the chest, hard and fast, about 100 to 120 times each minute. Use an AED as soon as it arrives and follow its prompts. CPR does not recreate a normal heartbeat. It moves only a fraction of normal blood flow. But that fraction can carry oxygen toward the brain and heart while help is coming. The AED checks the rhythm and shocks only when appropriate. You're not trying to finish a perfect rescue by yourself. You are buying the brain its most valuable resource, time. So what if your brain lost oxygen for 5 minutes? Awareness would disappear early. Cellular energy would fail. Swelling and chemical injury would build, with the most sensitive regions placed at greatest risk. Some neurons might already be dying before the timer ends. But the real lesson is not that 5 is a magic number. It is that every second before CPR and defibrillation matters.